Fireman Mika Weller, and I'm from the Wing Public Affairs Office from Fairchild Air Force Base. I'm here today at the 92nd Medical Group with Major Helene and Lieutenant Colonel Lazenby. So we're going to be talking about the hazardous condition that we have in the air recently because of all the forest fires that we've been experiencing in our areas. Is there anything that you guys would like to add as far as the conditions outside? I mean, we're being told to wear masks so that we don't have respiratory issues.
Yeah, so thanks for the great question. Welcome back from the nice long weekend to Ash Wednesday. We wanted to emphasize a few things. So with the air quality, Colonel Samuelson sent out an email this morning to the wing emphasizing the importance of safety of everyone and how we need to mitigate the risk of the particulate matter that's in the air. So the people that are most at risk are people with lung disease and the old and young, and I can talk about that in a little bit in a minute. I'm going to turn it over to our bioenvironmental engineer specialist to give us some more information.
Hi, good morning, Fairchild. I just wanted to start off and tell everybody the current air quality index is 233. That is monitored at the Airways Heights monitoring station. So what does 233 mean on the air quality index? That means it's very unhealthy. That includes very unhealthy for even healthy individuals. It is the second highest tier on the air quality index. So what are our recommendations when we get into the very unhealthy category? First and foremost, we recommend that we curtail all non-mission essential outdoor activities. So if you're not required to be outside today, you stay indoors. You put those air conditioning systems on recirculate, and then if you must be outdoors, there's a couple of recommendations. One, increase worker rotation. So limit that time spent outdoors. And then two, we're recommending N95 respirators. Now that is a specific type of respirator. It will have an N95 rating on it by the National Institute for Occupational Safety and Health, or NIOSH N95 rating. Here's an example of an N95 respirator. Our technicians are coordinating with agencies on base right now to hand those out to units working outdoors today. And the importance of an N95 respirator is the seal that it will get on your face. So when you apply it to your face, you should get a good seal around the entire mask. And here's an example of a paper mask, not N95 rated, something you might get at your local hardware store, and then the N95 rated one. So we want to seek out these N95 masks and not these other masks. They won't provide the level of protection you need for the wildfire smoke. So again, curtail outdoor activities when we must be outdoors, increase worker rotation, and wear an N95 respirator mask. Go ahead and limit your PT or just curtail the PT until the air quality improves. And for updates on the air quality, you can reach out to Spokane Clean Air Agency's website and go ahead and Google that. And we're tracking the Airway Heights monitoring station. We are very unhealthy right now, and Colonel Lazenby has a little bit more on that.
Yeah, so if you have anybody that you're concerned about because they're experiencing symptoms, particularly if they have a known respiratory illness like asthma, please contact your PCM if you're enrolled here at the 92nd Medical Group so that we can evaluate the severity of your symptoms and then treat you accordingly. People have asked, is there a need to be seen just because of the smoke in the air? The answer to that is no. It really is symptom-based. And the people that are most at risk for having a negative effect of the air quality are those that are young, those that are old, and those that have a known cardiovascular or respiratory illness. So please let us know if you have a concern so we can get you taken care of. And please stay safe and minimize your exposure. The amount of exposure you'll get coming to and from a doctor's appointment, going to the store, or going to school is minimal and shouldn't cause any problems, but just avoid extended periods of time outdoors.
All right, so if you need more information, just make sure that you stay tuned with us on our Fairchild Air Force Base page on Facebook, just to make sure that if you need any updates, we will be trying to get them out there as soon as we have them. As soon as we get more information, we'll be putting them out there for your information, just so you can stay updated. And is there anything that you guys would like to add as far as who people can contact or what to do if they have questions?
Team Fairchild members can absolutely reach out to the Bioenvironmental Engineering Office. Our number is 247-2391, and we're happy to answer answer any questions you have as it relates to respirators or recommendations for your workers.
And any active duty members or family members that are enrolled here at the 92nd Medical Group, please call the appointment line and seek medical care as you normally would. For those people who are enrolled off base, please contact your primary care physician if you're experiencing any symptoms that you're concerned about.
Alright, well thank you for watching, and remember, stay tuned. If you need more information, we will have more as it comes out. Thank you so much for joining us, we really appreciate it.
Thanks a lot, it's a pleasure.